I think that my goal has not reached yet. I need to accomplish my entire service to the people. It has to be a complete service. If I remember where I came from and where I am and where I want to go, I'm sure I'd reach where I want to go one day.
Tanzania, a country of outstanding beauty and magnificent landscapes, home to some of the warmest and most welcoming people on the planet. Behind certain smiles, behind that laughter, might lie an ocean of worries and uncertainties. Some areas of concern include HIV, poor education, and a high child death rate. Yet there is hope, or as the locals would say, Faraja. "20 years ago, in 1998, a gentleman named Samwel Minja dedicated his life to the people of Himo.
My parents, they said to me that you either choose between job and parents. So this was very hard for me to decide, but eventually I decided for parents. And I left the job and I stayed at home, jobless. And I stayed for about 6 months at home, jobless. And I was walking around Himo one day, and then I found a certain small house, on the window written dispensary.
Today, Faraja is a 3-story hospital, staffed by many doctors, nurses, and technicians.
Most patients, they do come here while they are already in very critical condition. Like here, you can see this is a minor theater. We use it as a place where those who are involved in minor accidents or even major accidents, they come through here first. And then once we see that they need an operation, we take them in the operating theater. Sometimes a patient may come that may require a specialist. For example, a patient with a heart disease. I'm a general practitioner, so I may do my part, and sometimes I think this patient has to be seen by a specialist, and there are no specialists here. Even if we had a CT scan and we could understand that this patient required maybe a brain operation, we couldn't have performed it because we don't have a neurosurgeon. That's a problem. To get a neurosurgeon is not very easy because in other centers they have to train their own people, and it is not very easy because it is sometimes expensive to train them and it takes many years of study. But I know here in Faraja we have people who are maybe willing to do that.
All of this forward thinking is attracting people from all across the country and even across borders.
Basically, I'm not from this region. I came from south part of Tanzania, and I came to visit my friends, and I was told to visit this place because I'm sick.
I come from a healthcare from my village for some blood investigation.
From the time that I was received at the reception, everything is really well advanced. I came all the way from Voi, Kenya, because I heard a lot about this hospital and the service provided here?
They were only able to do 2 tests, and now I have to catch a bus to Moshi town for the remaining 3 tests. Unfortunately, not everything could be done here.
Unfortunately, the doctor have discovered that I have a colon tumor. Now they have to transfer me to KSMC for a review by a specialist.
Yeah, it is very fantastic what Dr. Minja built up in the last 20 years. I think he and we can be very proud about this, and now it's time to improve the quality in the hospital. And I think it's very important now that they have some specialists.
Despite the hospital being fully functional, with over 150 patients on a daily basis, there remains an infinite thirst for knowledge. This thirst demonstrates the potential for future growth.
From last year to today, and in the next year, so many things have changed. For example, Dr. Minja, he was capable to change the documentation system in the hospital. Now he has an IT system. Everything is digitally, and within 1 year they removed completely or changed the system in the radiology. It's great. Now everything is digitally. That is perfect. And so even when I would compare this hospital with hospitals in Germany, there are a lot of hospitals which are not on that stage.
Both education and specialization are essential for future growth. This is why Dr. Minja founded and financed a training institute which lies in the proximity of the hospital.
My name is Dr. Upendo Matoli. I'm the principal of the Faraja Health Training Institute. Our college is located at Himo town. We offer courses in clinical medicine, certificate, and we're looking forward to diploma, certificate in clinical medicine. We would like to expand and offer other clinical or allied health courses like environmental health and community health. We have capacities in our classrooms. We have capacity for 200 students. We have 2 lecture rooms. Our computer lab currently can only support 20 students at a go.
Sometimes people call here and here and here, so and you can see that this is the message.
My name is Mudhe Evarest, and I am IT manager. I manage IT logistics here in the college and in the hospital. Now technology is advancing, and technology is making everything very cool and very simple. Examination officer can upload some results in the system, and the students can retrieve the results anywhere they go, anywhere at home or anywhere.
The advantage of our college is we have our own hospital, which is free for students to practice any time of the day, night and day, 24 hours. Yeah.
Only one person created this hospital, the whole hospital, within 20 years. And this is really absolutely impressing and convincing that this is a great project and a great vision even for the next decade or next years.
It doesn't matter who you really are, but it matters what you really have in your brain, like your dreams. Because looking at my father as a assistant medical officer with the advanced diploma in medicine, and do what he has just done here, And I have a lot of other people I know that they're professors, they're specialists, they have a lot of money, they have everything that they need to have, and they can do marvelous things, but what they lack is dream.